在中国的神话故事中，孙悟空被头上的紧箍咒所束缚，而 Sana Health 的紧箍咒却尝试去除疼痛，带来自由。
Let's take it home.
You could be swinging. Well, my first step on that road to recovery was watching a film called Hudson Hawk. 27 years ago, I was forced to drive a Jeep off a bridge in the Yemen. That resulted in spinal injuries and a nerve damage pain problem that was so severe I was given a 5-year life expectancy. And that film, by showing me how flow states changed my pain levels more than opioids, inspired me to make a device that anybody could use anywhere to produce that flow state and thus reduce pain and anxiety. I've been very lucky to be supported by a great team. We are aiming to use my device and my experience to therefore help tens of millions of people around the world. Three hours after this photo was taken, I was forced to drive that Jeep off a bridge. Went down 60 feet into a dry riverbed, and the car basically crashed like a Coke can. That resulted in a torn aorta and a spinal cord injury from T8, T10, all of which resulted in a nerve damage pain problem that was so severe I was given a 5-year life expectancy. Imagine waking up every morning with the worst pain you've ever had and knowing that that would continue all day, every day until it finally killed you. Well, that was me. So back in the UK, I was put through the standard of care, which hasn't changed in 27 years. It was opioids, other drugs, implantables, TENS devices, and eventually when all of that fails, they give you some meditation to hopefully take the edge off. Well, my pain levels were way too extreme to have any chance of learning to meditate, and it's generally the problem with meditation when you're already in pain. So I started thinking, given the experience I had with a film and a flow state improving my pain levels, what if I had the brain producing the EEG patterns that you get after 20 years of meditating? Well, luckily for me, there was already 50 years of research into EEG states produced by meditating. And the key learning was that you get perfect hemispheric balance between the two sides of the brain and specific strengths at alpha and theta frequencies. For me, this was the roadmap to build a device that would then help other people. So this is a typical result that we had. So on the left, you can see a big disparity between the two hemispheres of the brain in someone with chronic pain. And then on the right, you see a balanced brain after a cumulative 4 hours of using the device, which then results in much lower pain, and within 10 minutes, a great deal of relaxation effect and increase in neuroplasticity. So how do we do this? Well, the device that I have, the first production version here, uses pulsed light and sound and a heart rate variability feedback loop to create very specific patterns in the brain and fix that hemispheric balance difference. For me, the device took 3 months to completely wipe out all of my nerve damage pain, and I haven't had a minute's pain since 1993. So there are 100 million people in America who suffer from chronic pain, which is our first market, and within that, we're targeting fibromyalgia. Now, 1.5 billion people worldwide suffer from chronic pain. And just imagine a world where actually all of those people had an option that was not a drug that could help them with that chronic pain. So with great claims come great responsibility to provide evidence. We've done 4 clinical trials so far. These are the first 3. The first one was with Stanford and Special Operations Command, where we got a doubling of pain relief, a doubling relaxation, a tripling of pain relief, and a 5x improvement in sleep. We then did an opioid use disorder study. We got methadone addicts in a full withdrawal, and at that point of full withdrawal, we got a 45% reduction in anxiety. And then fibromyalgia, it's 3 to 5% of people globally, 80% women, and it's a lifelong debilitating pain condition where the best drug produces 10% improvement in symptoms. We got a 45% reduction in 2 weeks, and a follow-up of 4 months showed those results are only improving. Now, within that study, we also got a 46% reduction in anxiety, which is better than Xanax, a 49% reduction in in depression, which is better than Prozac, and we got a 39% reduction in pain in the 5 worst sufferers. In our most recent study, we did a 24-hour fatigue mitigation study for a NATO Innovation Challenge. We got an improvement in reaction speeds, 3 times reduction in fatigue symptoms, and 50% of the people who are using the device actually ended the study less stressed than they were when they started. We've got the top hospitals in the US helping us do larger clinical studies. Mount Sinai on neuropathic pain, Cleveland Clinic on multiple sclerosis, and Walter Reed on lower back pain. So we are commercially launching next year, and we are doing those clinical trials in parallel, so it's a limited commercial launch. The new distribution partners are, as I said, NATO for improving behavioral health and hopefully limiting PTSD, and Anthem, which covers 1/3 of American lives. So Sana saved my life, and we've already helped hundreds of people. And our aim is to improve the lives of 1.5 billion people over the next 10 years. Obviously, that is a massive target, and so we are after all the help we can get. Thank you.
Thank you so much. 我们把掌声送给 Richard. Sorry, I had to cut you a little short. All right,
Sure.
let's go and start our Q&A session. I think it's amazing what your product could do in the States where we have a really big opioid
Thank you.
epidemic. 好，我们进入我们的问答环节，我们的观众可以开始打分数。Do you have questions for Richard?
Well, I can start. Out of curiosity, you mentioned you've been pain-free since, was it 1993?
Yeah.
So, yeah, how can you give us a bit more of the history of this?
Yes, certainly. So the early device was all done using EEG as a feedback loop. And I was a manual part of that feedback loop. So everyone I worked with, I had to go along with 2 Pelican cases full of gear, including EEG, 2 laptops to work with every single person. The problem was I couldn't automate it so someone could actually use that at home whenever they needed to use it. That problem was solved when someone developed a heart rate variability sensor, and the US Air Force medics sent me a sample in 2015 that was about that big. And at that time, I realized that that was going to enable me to replace EEG in making the complete feedback loop. So I relaunched the company in 2015. So everything you saw on stage was basically since the beginning of 2015.
Can I just one follow-up question as well?
Of course.
I'm not sure I actually get how it works. Can you explain what the device does and
Yeah.
how it works?
Certainly. So we're using pulsed light through the retina of the eye and sound into the ears. And the brain has a thing called frequency following response. It'll actually respond to any input frequency by adopting that frequency. And by doing that, we can increase neuroplasticity on those specific frequencies. Now, the thing that you can't do with drugs, electrics, or magnetics, which are the other 3 modalities for affecting the brain, is create that hemispheric balance. Now, with light and sound, you can do that because you can use the eyes and the ears as 4 separate inputs, and you can circle between them in a way that then generates that balance between the 2 sides of the brain, and that then triggers the ability to relax in a very different, deep way that isn't possible with any other modality.
Actually, Peter asked the 2 questions that I wanted to ask, so I'll ask the follow-up on that. So this technique needs to be adapted to every patient, right? So there is some machine learning for every patient and patient?
Yeah, so there's a basic pattern that works for everybody. And then on top of that, there's a feedback loop which then personalizes it to improve that efficacy above the base. And that is where the machine learning comes in, yeah.
Professor Smoot?
If I could have a little time. So what I didn't understand is what of your technology is actually patentable? I know of devices out there that do, frequency modulation by light and other things. What gives you a unique strength and protects yourself in the market? Just that you already are far enough along?
Yeah, certainly. So the first patent was actually issued in June that covers the combined use of rhythmic pulses of light and sound. The second patent, which is actually pretty much the same prior art with a little bit of additional protection, is on the feedback loop controlling those underlying patterns. The third one within pain covers any rhythmic use of either light or sound in order to produce that effect. Again, the same prior art. So the patent portfolio is strong. On top of that, we'll be layering a large amount of data that we will be generating very quickly that will give us a further lead into how we can improve and stay ahead of competition if they find ways around our patent protection.